Welcome to this training on how to safely prepare and serve thickened liquids for individuals with dysphagia. In this video, you will learn why thickened liquids are used, how to prepare them correctly, and how to support individuals during meals. The goal of this training is to help reduce the risk of aspiration and improve swallowing safety, ensuring individuals receive proper hydration and care in a safe and supportive environment. This training is provided for educational purposes only. The information presented is intended to increase awareness and understanding of thickened liquids and swallowing safety. Any changes or modifications to a dietary plan, including food textures or liquid consistencies, should only be made under the direction and supervision of a qualified medical professional. This may include a physician, speech-language pathologist, occupational therapist, or another healthcare provider responsible for the individual's care. Always follow the care plan and instructions provided by the healthcare team and your facility's policies and procedures when preparing or serving modified diets. What is dysphagia? Dysphagia is the medical term used to describe difficulty swallowing. Swallowing normally requires many muscles and nerves working together. When these muscles or nerves are weakened or damaged, the swallowing process may not work properly. Individuals with dysphagia may have difficulty safely swallowing food, liquids, or even medications. For some individuals with swallowing difficulties, thin liquids such as water can move very quickly through the mouth and throat. Because they move so fast, the body may not have enough time to properly coordinate the swallowing process, which can increase the risk of liquid entering the airway instead of going to the stomach. Thickened liquids are used to slow down the movement of the liquid, giving the swallowing muscles more time to respond and protect the airway. This helps improve swallowing safety and reduces the risk of aspiration. Aspiration and choking are two different types of swallowing problems. Aspiration occurs when food or liquid enters the airway or lungs instead of traveling down the esophagus to the stomach. This can sometimes happen silently, meaning the person may not cough or show obvious signs. Choking, on the other hand, occurs when food or an object blocks the airway, preventing air from moving in and out, which makes it difficult or impossible to breathe. While aspiration may not always be immediately noticeable, choking is a life-threatening emergency that requires immediate action. Several medical conditions can affect a person's ability to swallow safely. Individuals who have experienced a stroke, traumatic brain injury, Parkinson's disease, or certain neurological conditions may have dysphagia and require thickened liquids. Thickened liquids are often recommended for individuals who have difficulty swallowing safely, a condition known as dysphagia. Swallowing is a complex process that requires many muscles and nerves to work together to move food and liquids from the mouth to the stomach while protecting the airway. When this process is weakened or disrupted by illness, injury, or certain medical conditions, thin liquids may move too quickly and increase the risk of aspiration. Thickened liquids move more slowly, giving the body more time to coordinate a safe swallow and helping protect the airway. Several groups of people may require thickened liquids as part of their care plan. Individuals who have experienced a stroke may have damage to the muscles or nerves involved in swallowing. People with Parkinson's disease may have reduced muscle control and coordination, making it harder to swallow liquids safely. Those who have suffered a traumatic brain injury may also have difficulty controlling the swallowing muscles due to damage to the brain. Individuals living with dementia or Alzheimer's disease may lose the ability to coordinate safe swallowing as the disease progresses. People with neurological disorders, such as multiple sclerosis, ALS, Lou Gehrig's disease, or cerebral palsy, may also have swallowing difficulties because these conditions affect nerve signals and muscle control. Thickened liquids may also be necessary for individuals who have had head or neck cancer, particularly if surgery, chemotherapy, or radiation has affected the structures used for swallowing. Older adults may sometimes develop swallowing difficulties as the muscles involved in swallowing weaken with age. In addition, people who are recovering from surgery, illness, or hospitalization may temporarily require thickened liquids until their swallowing ability improves. Some individuals with developmental disabilities may also have swallowing disorders that require thickened liquids for safety. Ultimately, the need for thickened liquids is determined through a swallowing evaluation by a qualified medical professional, such as a speech-language pathologist, physician, or occupational therapist, who can determine the safest liquid consistency for the individual. Providing the correct liquid consistency is an important part of preventing aspiration and helping individuals with swallowing difficulties eat and drink more safely. Liquids include more than just beverages. Many foods become liquid at room temperature. This may include broth, melted ice cream, gelatin, or nutritional supplement drinks. Liquids include any food or beverage that flows or becomes liquid at room or body temperature, such as water, milk, juice, coffee, tea, soup broth, nutritional drinks, gelatin, and foods that melt into liquid like ice cream or popsicles. Commercial thickening products are typically used to thicken liquids for individuals with dysphagia. These may include starch-based powders, gum-based thickeners, or gel thickening products. The International Dysphagia Diet Standardization Initiative, known as IDDSI, is a global framework developed to standardize how food textures and liquid thickness levels are described for individuals with swallowing difficulties. The goal of IDDSI is to improve communication and safety among healthcare professionals, caregivers, and food service staff by using consistent terminology and testing methods. However, not all healthcare facilities or care settings have fully adopted the IDDSI framework. For this reason, it is important to always follow your facility's policies and procedures and refer to the guidelines established by your organization to determine the appropriate terminology, testing method, and liquid consistency standards to use. IDDSI defines several levels of liquid thickness ranging from thin liquids to extremely thick liquids. These levels help healthcare providers communicate clearly about the safest liquid consistency for individuals with swallowing difficulties. Some healthcare facilities may still use traditional terminology to describe thickened liquids. Nectar-thick liquids are similar to fruit nectar. Honey-thick liquids flow slowly like honey, and pudding-thick liquids hold their shape. Liquid consistencies may be modified to help individuals with swallowing difficulties safely consume beverages and certain foods. These consistencies range from thin liquids to very thick liquids, and each level has a different texture and flow. Thin liquids include beverages such as water, coffee, tea, soda, juices, milk, and melted foods like ices. These liquids flow quickly and easily and will typically liquefy in the mouth within a few seconds. Nectar-like liquids are slightly thicker than thin liquids. They are often compared to fruit nectars such as apricot or peach nectar. Nectar-like liquids have a consistency that lightly coats a spoon and slowly drips off. They are thicker than water but still pour easily. Honey-like liquids are thicker and move more slowly. When poured from a spoon, the liquid flows off in a slow, steady ribbon similar to the way honey flows. This thicker consistency allows the liquid to move more slowly through the mouth and throat. Pudding-thick liquids are the thickest liquid consistency. These liquids do not pour easily and remain on the spoon in a soft mound or mass, similar to pudding. Because of their thickness, they are typically eaten with a spoon rather than drunk from a cup. These different liquid consistencies are prescribed to help individuals with swallowing difficulties safely consume liquids while reducing the risk of aspiration. Here are the basic steps for preparing thickened liquids. Verify the order. Always check the prescribed liquid consistency before preparing any beverage. Select the correct thickener. Use only the thickening product approved by your facility or care team. Measure the liquid accurately. Follow the exact volume recommended in the product instructions. Add the thickener as directed. Use the correct amount, since different products and liquids may require adjustments. Mix thoroughly. Stir or shake until the thickener is fully dissolved and evenly distributed. Allow the liquid to set. Let the liquid sit for the recommended time, as it may continue to thicken. Check the consistency. Test the liquid using the appropriate method to ensure it meets the required thickness before serving. Here is an example of instructions. To prepare thickened liquids with a commercial product, pour 4 fluid oz of liquid into a glass and slowly add the measured thickener while stirring briskly with a fork or whisk until dissolved. Allow water or juice to stand for at least 1 minute, and milk supplements for 5 to 10 minutes to reach the desired consistency. Additional tips and precautions include stirring. Use a fork or whisk to prevent lumps. Rest time. Always wait at least 1 minute for liquids to fully thicken. Checking. Test the consistency before serving, ensuring it is not too thick or too thin. Alternative methods. Thickeners can be added to hot or cold foods and beverages. If the mixture is too thin, add more thickener. If too thick, add more liquid. The IDDSI flow test is used to measure liquid thickness. A 10 ml syringe is filled with the liquid and allowed to flow for 10 seconds. The amount of liquid remaining determines the thickness level. Step-by-step instructions for testing the flow of liquids. Gather your supplies. You will need a 10 milliliter syringe, a timer or stopwatch, the prepared liquid to be tested, and a cup to catch the liquid. Check that the syringe is correct. Use the type of syringe recommended for the IDDSI flow test. Make sure it is clean and dry before use. Cover the nozzle opening. Hold your finger over the tip of the syringe so the liquid does not flow out while filling it. Fill the syringe to 10 milliliter. Pour or draw the prepared liquid into the syringe until it reaches the 10 milliliters line. Start the test. Hold the syringe upright over the cup. At the same time, release your finger from the nozzle and start the timer. Allow the liquid to flow for 10 seconds. Let the liquid run out of the syringe naturally for exactly 10 seconds. Stop the flow at 10 seconds. At 10 seconds, stop the test by covering the nozzle or removing the syringe from the test position. Measure the amount remaining in the syringe. Look at how much liquid is still left in the syringe after the 10 seconds have passed. Compare the result to the required consistency. The amount of liquid left in the syringe helps determine the thickness level. Follow your facility's guidelines or IDDSI standards to confirm whether the liquid is at the correct consistency. Adjust if needed. If the liquid is too thin or too thick, adjust the recipe, mix again, allow it to stand if needed, and retest. Preparation can vary by product. A starch-based thickener, a gum-based thickener, cold juice, warm coffee, milk, or a nutrition supplement may not all behave the same way, so the safest practice is to follow the label directions, allow the stated standing time, and test the final consistency every time. Some thickening products continue to thicken after they are mixed. Because of this, it is important to follow the manufacturer's instructions carefully. Adding too much thickener can lead to constipation or weight gain. When preparing thickened liquids, it is important to understand that not all liquids thicken in the same way. The type of beverage being thickened can affect how the thickening agent works and how quickly the liquid reaches the desired consistency. Factors such as temperature, carbonation, and the composition of the beverage can influence how well the thickener mixes and the final thickness of the liquid. Temperature can affect thickening. Cold liquids, room temperature liquids, and hot beverages may thicken at different rates. Some thickening agents may take longer to fully activate in cold liquids, while hot liquids may thicken more quickly. Because of this, it is important to mix thoroughly and allow the recommended standing time so the liquid can reach the correct consistency before serving. Carbonation may also affect mixing. Carbonated beverages, such as soda or sparkling water, contain bubbles that can interfere with the mixing process. The carbonation may cause foaming or make it more difficult for the thickener to dissolve evenly. In some cases, carbonation may need to be reduced or allowed to settle before thickening. Other characteristics of beverages, such as protein content, acidity, or sugar levels, may also affect how a thickening product behaves. For example, milk, nutritional supplements, and acidic juices may thicken differently than water. Because of these differences, it is important to follow the manufacturer's instructions carefully, mix thoroughly, allow the recommended standing time, and test the final consistency to ensure the liquid meets the prescribed thickness level. Testing the thickness or viscosity of liquids is important because liquids that are too thin may increase the risk of aspiration. Testing the thickness of liquids is an important step in preparing beverages for individuals who require thickened liquids. The correct liquid consistency helps support safer swallowing and reduces the risk of food or liquid entering the airway. If a liquid is too thin, it may move too quickly through the mouth and throat, increasing the risk of aspiration. If a liquid is too thick, it may be difficult to swallow and may not match the prescribed diet order. Testing helps ensure the liquid has reached the correct consistency according to the individual's care plan. Methods such as the IDDSI flow test or utensil tests can help confirm that the liquid meets the appropriate thickness level before it is served. Checking the thickness is also important because liquids may continue to thicken over time or may behave differently depending on the type of beverage, temperature, or thickening product used. By testing the final product, caregivers and food service staff can make sure the liquid is prepared safely and consistently. Ensuring the correct consistency helps protect swallowing safety, support proper nutrition and hydration, and reduce the risk of aspiration or other complications for individuals with dysphagia. Thickened liquids must follow the same food safety practices as any other food or beverage. Perishable liquids such as milk, juice, and nutritional drinks should always be kept refrigerated until they are ready to be used. Thickened liquids should not be left sitting at room temperature for extended periods of time, because bacteria can grow and the liquid may no longer be safe to consume. Proper storage and handling help protect the safety and health of individuals who rely on thickened liquids. Mixed consistency foods contain both solid and liquid components in the same food item. Some individuals with swallowing difficulties may have trouble safely managing foods with mixed textures because the liquid and solid parts move differently during the swallowing process. This can make it more difficult to control the food in the mouth and coordinate a safe swallow. Common examples of mixed consistency foods include cereal with milk, canned fruit and juice, and soup with noodles. For individuals who are allowed to eat mixed consistency foods, the liquid portion may need to be thickened to the prescribed liquid consistency to help support safer swallowing. When preparing foods for individuals who require thickened liquids, it is important to monitor for excess liquids that may separate or be released during preparation or serving. Some foods, such as canned fruits, cooked vegetables, or foods that contain sauces or juices, may naturally release liquid over time. If this liquid is thin, it may not match the prescribed liquid consistency and could increase the risk of aspiration. To help maintain the correct consistency and support swallowing safety, any excess liquid should either be drained off or thickened to the required consistency before serving. Properly managing excess liquids helps ensure that the food remains safe for individuals who require modified liquid textures. Individuals with dysphagia should be evaluated by a qualified medical professional to determine which food textures and liquid consistencies are safe. Individuals who may have difficulty swallowing should receive a professional swallowing evaluation conducted by a qualified healthcare professional such as a speech-language pathologist, occupational therapist, or medical doctor. During this evaluation, the healthcare professional carefully assesses how well a person is able to chew and swallow different types of foods and liquids. The evaluation helps determine the safest food textures and liquid consistencies for that individual to reduce the risk of aspiration and support safe eating and drinking. A swallowing evaluation may also determine whether a person can safely tolerate mixed consistency foods, such as cereal with milk or fruit and juice, as well as foods that naturally contain more liquid, such as juicy fruits and vegetables. Based on the results of the evaluation, the healthcare professional can recommend specific diet modifications that help protect the airway and support safe swallowing. Following these recommendations is an important part of helping individuals with swallowing difficulties maintain proper nutrition and hydration while reducing the risk of complications. When assisting someone who requires thickened liquids, it is important to observe them during meals. Some individuals may not tolerate certain food textures or liquid consistencies, which can increase the risk of aspiration or choking. Common signs and symptoms that may indicate poor tolerance include coughing during or after eating or drinking, frequent throat clearing, a wet or gurgling sounding voice, and difficulty breathing while eating or drinking. These symptoms may suggest that food or liquid is not being swallowed properly and may be entering the airway. If any of these signs are observed, it is important to stop feeding or offering liquids and notify the nurse or healthcare professional responsible for the individual's care immediately so the situation can be evaluated and appropriate instructions can be provided. It is important to closely observe individuals who require modified food textures or thickened liquids during meals. If there are any changes in swallowing ability or tolerance, these changes should be reported immediately to the nurse or healthcare professional responsible for the individual's care. Signs such as coughing, choking, throat clearing, changes in voice quality, or difficulty breathing during eating or drinking may indicate that the current diet texture or liquid consistency is no longer safe. Promptly reporting these concerns allows healthcare professionals to evaluate the situation and make any necessary adjustments to help ensure the individual's safety during meals. Understanding the safe use of thickened liquids is an important part of supporting individuals who have difficulty swallowing. Dysphagia, or difficulty swallowing, can increase the risk of aspiration, which occurs when food or liquid enters the airway or lungs instead of going into the stomach. By understanding dysphagia and the reasons thickened liquids may be recommended, caregivers and food service staff can help reduce this risk and support safer eating and drinking. Preparing thickened liquids correctly and consistently is essential. Liquids should be mixed according to the manufacturer's instructions and the individual's prescribed consistency level. Testing the thickness when appropriate and preparing liquids close to serving time helps ensure the correct consistency is maintained and supports swallowing safety. It is also important to monitor individuals carefully during meals. Observing for signs of swallowing difficulty, such as coughing, throat clearing, changes in voice quality, or difficulty breathing, can help identify when a person may not be tolerating a certain food texture or liquid consistency. Any concerns should be reported immediately to the nurse or healthcare professional responsible for the individual's care. By understanding dysphagia, preparing liquids correctly, and monitoring individuals carefully, caregivers can play a vital role in helping protect the health, safety, and well-being of individuals who require thickened liquids. This training material is provided for educational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment. It is not a substitute for professional medical care. Always follow your organization's policies and procedures, as well as local health department regulations, when preparing and serving foods or liquids for individuals in your care. Don't miss out. If you're enjoying the content, make sure to like the video, subscribe to the channel, and hit that notification bell so you never miss an upload. We've got more awesome content coming your way. Stay tuned.